So I'm very happy to be able to introduce Keren Tzarfaty, PhD, is going to give a title on Somatic Psychotherapeutic work in Psychedelic Psychotherapy. She is the Executive Director of MAPS Israel and a co-founder of Hakomi Institute of Israel. She leads the psychedelic-assisted psychotherapy studies, leads not the, but an important one, which is the MDMA PTSD FDA-approved clinical trial, which is examining the impact of MDMA-assisted psychotherapy on severe PTSD patients. She's one of the founders of the new MA program at Haifa University, Integrative Psychotherapy, Body, Mind, and Spirit. Yes. So she's very much into somatics and psychedelics, I can say. I'll skip the rest of the biography so you have more time for your talk. Thank you very much.
Thank you, David. Thank you very much. And hello, everybody. It's very nice to be here with you. Hi. So I'm happy to share with you a little bit of what I know about the integration of somatic psychotherapy into psychedelic therapy. And I will touch a little bit, because it's a short time, but I will touch a little bit in MDMA-assisted psychotherapy and psilocybin-assisted psychotherapy. So I'm going to share my slideshow with you. Let's see that I'm able to do it. 1 second. Here you go. Okay. So, somatic psychotherapeutic work in psychedelic psychotherapy. And I try to bring today my knowledge from those two roles I have. One is as MAPS, Multidisciplinary Association for Psychedelic Studies trainer in Israel, leading the trainings for psychotherapies. And also my knowledge in Hakomi, which is a body-oriented, mindfulness-based psychotherapy that invites, I would say, both the therapist and the participant, the client, to really get connected to their somatic body, somatic experience that is very much focused on the body, but not only. So we will discover it together, okay? And I want to start by putting my gratitude to grandmother Julieta Casimiro, and she is from the Mazatec people in Mexico, and I was blessed to study with her and to learn a lot about the way psychedelics are being held in the tradition of the Mazatec people, and to Françoise Bourza and Aaron Grossbart, who studied with Julieta and taught me so much, and so much about somatic in psychedelics. So thank you very much for them. Let's talk for a minute about what somatic is and where is it coming from. I want to talk in a little bit about the roots of the somatic movement or somatic psychotherapy movement. And in a very interesting way, there are two main roots to this work. The first one is coming from the body practices. So at the beginning of the 19th century and towards the into the 50s and 60s, where the humanistic psychology movement got a lot of space and influence. During those 50 years or 60 years, people from, mostly women, interesting, but mostly women in gymnastics in Europe, in movement and dance, both in Europe and in the US, from physical therapy, again in Europe, in the US, women that started to get familiar with the inner experience of the body and starting to be curious about what is it being in our body? What does it mean to be embodied? What does it mean to have muscles and bones and fascia, the connective tissue? What does it mean from a psychological point of view? So those pioneers, the somatic pioneers, were very much influenced from Eastern traditions and practices, from homeopathic medicine and more, and started to bring lots of I would say new ways of looking at the body, moving from external, objective, the way the body should look like, to what does it mean to feel the body from within. or even what does it mean to feel ourselves from within or to know ourselves from within. And then in psychology, William Reich and Boysen and Lowen, people that came from the psychology field, started to be very curious about the role of the body in psychology and psychotherapy, the role of the muscles, the bones, the armoring, places where we get, I would say, like we places in the body that get to be much more harder and stiff, and they hold memories. So when a child is having a difficult experience in childhood, it's not only an emotional difficulty, it's not only a psychological, heady, difficult experience, but the body is participating in this experience, and the muscles are getting narrow. If there is a heart breaking, yeah, or a fear, I would say a sense of limitation, of freedoms or needs. So the body is participating in this limitation, and the muscles are joining the stiffness of the internal experience. And actually, specific places in specific locations around the body are getting armored. That's how Reich described it and his followers. So if I'm going back to those two roots, if I'm looking at the somatic like a tree, so those two main roots, the body practices and the psychology, both started to do this integration of psychological work with the way the body participated in it. And all of them started to, I would say, reject the external, objective way of thinking about the body. It should look at some specific way, or to be in a specific way, and to understand that the body, especially as we experience it from within, knowing ourselves from within as a emotional body and physical body, knowing ourselves as a subjective, mysterious, very rich, colorful way of knowing ourselves as a somatic body, humans, yeah? And I would say that all of those modalities, many modalities and many schools and in the somatic field, some of them are more rooted in psychology and some of them are more rooted in the field of the body practices, and many integrations. Hakomi is one of them. One thing that they all share is the body-mind principle, what you see below in the slide, that the understanding that the body is an expression of the unconscious. And every time that we had a repetition of psychological experience, it can be a positive, healthy experience, or it can be a limited, hurtful experience. Our body has a way in which it participates in this experience. And as we get older and we come to therapy as clients, we have this really amazing opportunity to slow down and to start knowing ourselves from within as this body and deepen into places, emotional, physical, sensational, in terms of sensations, places in our experience, and then to discover there in terms of the unconscious internal material, to discover knowledge about our past, about our present, about behavior, about the way we organize around experience, about the way we organize about knowing ourselves, knowing others, and knowing life. Yeah. So the body-mind principle is teaching us that we can really study who we are from our body somatic perspective and learn a lot about different habits and different ways we organize internally and externally. Ben Hanna and Don Hanlon Johnson, who was also my teacher, Don, looked at all those new schools that were flourishing all over the US and Europe, and they created together this definition of somatic. And the way they present it is the feeling of oneself from within. Yeah, it's a first-person perspective, and that was the new paradigm. Not looking at the body from outside, but sensing, feeling, knowing oneself from within as the expert. I go inside and I study who I am in this moment in this body. Yeah, feeling of oneself from within. It is a first-person perspective. And then this, I would say, definition was expanded or kind of was presented in another way by Gendlin. He's the scholar and researcher and therapist that created focusing, which is another somatic modality that is wonderful. And Gendlin talked about our experience as the felt sense. Yeah. So in a way, he expanded the somatic view. So it's not so much focused only on the physical sensation or energy, the structure of the body, the posture of the body, but the inner experience is of a multidimensional nature, meaning in every given moment. Also now, as you're listening to me, and we're being together to some degree in this very unique, mysterious medium of online, but you're in the room listening to me. At this moment, you have this inner experience. And no matter who you are, right, no matter where you come from, you have thoughts, you have emotions, you have feelings, body sensations, impulses, images. I will also add energy. So in every given moment, your inner experience, and mine too, is characterized by those different categories of experience. Yeah. So some of us has more, I would say, more access to thoughts in category of experience. Some of us are more in contact with the emotional category of experience, the feelings. Some of us are much more into the body sensation or images. Yeah. So we have different, I would say, inner languages, yeah, of knowing yourself or being aware of ourselves. But really, all of us have this ability to have thoughts, emotions, feelings, body sensation, impulses, images, and energy in every given moment. And the content of those thoughts, emotions, feelings, body sensation, etc., is changing all the time. All the time, the content is changing, but the thoughts and the emotions or the containers of those contents, yeah, they're there for us almost all the time with those specific, I would say, specific characteristics that are unique to us or unique to our culture or to where we came from. So I actually invite you, as I continue to talk about somatic and psychedelics, to notice what you know about your inner experience right now. How much in this moment, as you listen to me, how much you feel connected to your body sensations. Yeah, do you feel something in your body right now that is alive for you? Maybe tension, or maybe openness or flow of energy, of life energy. Maybe you have images of things as you listen to me, that those images or even thoughts can be related to what I'm talking about, but they can be related to your job or to your family life, to the COVID, right? But I want to invite you, as we go on together, to notice what's happening inside of you. So Gendlin called it the felt sense. Yeah? And that would be, I would say, an expansion of somatic view to something that is much more, I would say, resonance with the truth of the characteristics of our inner experience, multidimensional nature of it. When we talk about somatic informed psychedelic therapy, and when I try to kind of make it easy for this talk, I want to present three concepts that I think are really important for therapists that work with participants with psychedelics. So the first invitation or concept, which I think is really the most important one, is to know how to be embodied, how to offer embodied therapeutic presence. So when I sit with my clients in the study, I don't want just to talk about things with them and to analyze it and to understand them. It's part of what we do, but it's a small part of what we do. And it's mostly good to do in the integration after the psychedelic experience. And while we are preparing the participants to get ready to have a psychedelic session, and while we're in this journey with them, we would like to be, as therapists, in embodied therapeutic present, meaning we want first to be present, not to think about things too much, not to be in other places that belong to the past or to the present, or to the future. We want to be with them there. I would say with the open heart and open mind. And one way I like to look at it is we want to be in a resting state, or resting as awareness. We want to be in an open awareness, a sense of being or a sense of presence, just allowing whatever shows up with the participant's experience to be there. And in a very interesting way, there is a process of limbic resonance, that when we get present and we are here with our body sensation, noticing our felt sense, noticing our emotions, our thought processes, noticing what's happening for us as we sit with our participant, with our clients, that also invites the participants to start get more grounded in the present experience, and to get to know themselves, or to get connected to what's present for them in their felt sense in the therapy process. And that's like, I would say, a golden opportunity, because if they go out of their head, of the thought process that we're so used to being, right? I'm thinking, therefore I am. I hope I'm translating it right. But we want them to start to know themselves not only as thoughts, right? As most of us are used to know ourselves as ideas or thoughts that we have. We want ourselves first, and then our participants to get connected to their present experience, to the felt sense. And the first step will be for us to embody therapeutic presence. And this therapeutic presence is also very much connected to awareness of our inner experience in the moment. We know that also as mindfulness, right? We want, on one hand, to be resting as awareness, or being open to what's there, and allow, I would say, a wide, mysterious space to just be there. But we also want to start noticing in a focused way of what's happening with our breath and body sensation, emotions, heart center, and so on. Okay, so that will be, from my perspective, a key to know how to hold space in an embodied way in psychedelics, from a somatic point of view. The second key is somatic tracking. And when I say somatic tracking, I really invite the therapist to be like a little bit like, I would say, detective, but in a very loving, present way, with kindness and good eyes and open heart, And what I mean by somatic tracking, it's a Hakomi term. We want to notice not the story of what the participant is bringing, not the words and the expression of the thoughts that he or she has, but the storyteller. I want to notice what's happening in the experience, in the inner experience of my participant as they talk to me. I want to notice their emotions, their level of energy, the way they hold their body. Because as I said at the beginning, with the body-mind principle of Hakomi and the somatic universe in general, we know that the felt sense and the way it's being experienced in the present moment is really like a gateway to unconscious material, to the wounds of the trauma, of the attachment, psychological developmental wounds, and just being connected as the participant, to this experience is a major, major step towards healing and growth. And somatic tracking is a skill that a Hakomi therapist have, or a somatic therapist has, and we know how to notice what's happening in the felt sense of the client, and to gently contact it and invite the client if they feel that this is relevant for them. It's always guided by the participant, by the client, not by us, because we have the techniques and the professional knowledge, but the participant, they're the experts of their own internal experience, right? So I can track something I can say, I just noticed that you put both your hands on your shoulders while you talked about this event. And if it feels relevant and interesting for the participant, I will invite them to stay with that. And that takes us to the third key, which will be inviting the participant to stay with the inner experience. Yeah. So we want us to be embodied in our felt sense, in open awareness, but also focusing, tracking what's happening inside of us. We want to use somatic tracking, that this is a skill that needs to be learned and practiced. This is a major piece of somatic psychotherapy. And we want to track what's happening as in the client inner experience, the storyteller, less the story. And then when the client is connected to meaningful things for them, and they will tell us what's meaning and what's not, we can invite them to stay with the, I would say, some clues or some seeds of movements, micro movements, breath, energy level, specific body postures, specific body sensation, places of tension, or places that feels that they are frozen or stiff, or it can be also places that are open and flowing. Those will be healthy places to be in touch with. Staying with those will be really wonderful gateways to what we call in MAPS the Mithofers, which are the main trainers of MAPS, so the original ones called the inner healer intelligence, yeah, or inner healing intelligence. So when we know how to invite the participant to stay connected to meaningful somatic clues, emotional clues, any kind of felt sense clues, the force of healing inside of them, some deep intelligence inside of them will start unfolding the process, and some meaningful process will start. So I want to go a little bit more into somatic tracking, noticing the difference between the story and the storyteller, what is happening with the person's body as they tell the story. So some things we always look at is body posture, breathing. Is it deep? Is it shallow? Is it fast or slow? And when I talk about body posture, I really look at the places that are leaning forward or leaning back, places that feels like they're very stiff and kind of being held in a tight way. We look at movements and micro movements. It's very interesting to see with people that suffer from PTSD how movements are starting when specific parts of the story are shown, are being presented, and when those movements or micro movements, little movements, are being stopped, and freeze state is showing up, and many times dissociation. We look at armoring, and as I mentioned in the beginning, which is a Reich term, places in the body that got stiff and blocked and very kind of hard. And those are places that if we walk with, just noticing them and staying with them, dipping into them, breathing into them, sometimes if it's appropriate in a very skillful way, in a very ethical way, we learn how to walk with it with touch. Yeah, so we can walk in different ways, different somatic skills and techniques with the armoring. And it's really amazing to see how when you invite a person to stay with an armored place, just to breathe, and even just to put their hand on the stiff armored place, how emotion is being released. Emotion that was held there from many, many years ago, the traumatic event or even before. We also track and noticing self-touch, places that the participant is holding themselves, yeah, hugging themselves, or kind of moving their hands on one hand on another, and you can really see how self-compassion is being born there. It's a beautiful, beautiful thing to dip into it and to stay with. And of course, we look at feeling states. So when I track somatic, I'm noticing, I'm making the connection, I'm connecting the dots. So I may notice that a person is not moving, the breath is very, very shallow and slow, the gaze in the eyes is really blank. Michael Mithofer calls it MDMA stare. They just look at you, and it's a question if they're there or not. Sometimes how connected they are to their inner experience or how dissociated they are. So when I look at all those dots and signs through somatic tracking, I can kind of understand that they're in a freeze state or in the dissociated state, or sometimes everything is really stormy, yeah? So the eyes are moving from one side to another, and the breath is really fast, and there are voices coming, and you see lots of intensity and panic. And so then I understand that they may be in a hyper state of regulation, meaning they're outside of regulation, and I want to help them to regulate themselves so they can stay connected. For those of you that like movies, there is a very, very interesting movie that was done on the study in Israel. The name is Trip of Compassion, and you can find it online. And here is a photo. This photo here is from the movie. Those are two therapists, and you can see how they use touch, and you can look at the body posture of the participant here, and there is a lot of meaning to what's happening here. And maybe we'll have time to deepen a little bit into it when we talk about touch, but I strongly recommend to those of you that are curious about the therapy in the MDMA studies and in psychedelic in general to look at this movie, Trip of Compassion. It's all based on the videos from the study itself, 3 participants. So that's a little bit about somatic tracking. I'm guessing you know a lot about MDMA, so I will just say a little in context of somatics. It was created in 1912 by Merck, and in 1985 it got to be in the US controlled substance, illegal. And in between those years, especially after the 60s and the humanistic psychology movements, and it was really used a lot in therapy in the West Coast. And a lot of what we know in study and research from the time is from books and interviews, people like Ralph Metzner and of course Groff and others that taught us a lot about psychedelics and also specifically about MDMA and what to do with this beautiful medicine in a relationship to many different wounds, but specifically to PTSD. And when we look at MDMA from somatic point of view, the experience is characterized by heightened senses. So people, they hear better and they hear more range of sounds, and they sometimes see in a much clearer way. There is increased awareness and mindfulness. It's much easier to notice the felt sense and to create connection to the felt sense, being mindful of what's happening inside of us. It increased acceptance of the ability to be with our felt sense, and it's easier to notice bodily sensations and emotions. So it's such a gift, MDMA, in general, and specifically for PTSD, because people that are suffering from PTSD or from extreme wounds, it's very hard for them to stay connected to their inner experience. And the tendency is to either block the experience or dissociate from it. And then, from a psychotherapeutic point of view, it's very hard to process it, because in order to process an experience, a difficult one, we have to be in touch with it, right? But if the experience is too much to be in contact with, and the automatic tendency of the nervous system is to disconnect from it in different ways, then it's very hard to process and walk through the difficult experience or the PTSD. The MDMA, because of the pharmacological profile of it, allows the participant to really stay connected to what's there, to what is, and we can invite the memory of the trauma and start processing the difficulty. It's a very difficult experience, but it's very, very meaningful. Yeah. So what MDMA does, the way I like to think about it, it expands the window of tolerance. So if the window of tolerance is limited when we suffer from PTSD or other extreme pathologies or illnesses, so then it's very, very hard to stay regulated, right? It's hard to tolerate the inner experience. But MDMA is expanding the window so people, or it allows people to experience presence, being with what is, and it allows an experience of regulation, which then allows the processing of the traumatic event. So from somatic point of view, it really allows connection to the felt sense because of the chemistry right, of the brain because of the mystery of psychedelics and life itself. And those are those beautiful mushrooms that their active ingredient is, there are many of them, but one main one is, of course, psilocybin. And when we talk about the experience of psilocybin or mushrooms, we're talking about a very intense multidimensional experience. So very, very high volume, high intensity of images and thoughts and feelings and sensations and energy, and all of them are at the same time, and they're going and coming back, and it's a very intense, beautiful, mysterious, strong experience. And I would say the main invitation would be to surrender and to trust the experience and just to let it be. So from somatic point of view, I would say that the main invitation with the psilocybin-assisted psychotherapy, or really with any classic psychedelic in a high dose, is to let the experience be, and as much as we can to just invite ourselves to experience it fully. But as therapists, we really want to keep those three keys that I will go back to at the end of the presentation. So the first one is embodied psychotherapeutic presence of the therapist, right? We want to be there and hold the space in a meaningful way. And from my point of view, it's very, very important to know those experiences in a personal way so we can hold them in a whole way and not get scared of them, because otherwise they can be very strange and intense and scary to hold mushroom or psilocybin experience without knowing it from within and not being scared of it. So we want this presence. We want to track somatically, felt sense tracking of where the participant is. It's harder to do the tracking piece relatively to the MDMA because the experience is very internal. But one key somatic tool we can use here is when the participant feels overwhelmed. Sometimes the experience is so hard, and then somatic resourcing and grounding can be very, very useful. And we can invite grounding through the body, just helping the participant to notice their body, the weight of their body, or just them being there as much as it's possible under the influence. We can invite them to be aware to the breath. And that's actually a very, very, with most cases, very useful techniques of regulation throughout a psilocybin session, inviting them to slow down with the breath, to slow down the rhythm of the session. And here it's also a very, very beautiful place to offer touch. And I know touch is very, very complex in our cultures and societies. So many wounds happened around sexuality and touch. And it's a very tricky subject because sometimes, or I would say most of traditional psychotherapeutic models taught us to be very, very careful, and that's true. And that in most cases it will be unethical to touch. But I would argue that in many cases it will be unethical not to touch. Because many of our, I would say, very early wounds, they really can be so much, to get so much help, clinical help, by use of accurate, ethical, and very, I would say, aware and clear touch. And also to say that many of the wounds we meet in the studies and in general, I think in psychotherapy, in clinical settings, are wounds that were done to humans by other humans. And there is something about the healing of those wounds that happening also in the relational setting. So it's not only internal experience of transformation, but it's really internal process that is very meaningful that happens internally, but also in relationship to the therapist or guides that are there holding the space. And sometimes just to have hands or a hand on the back just can be such a meaningful experience that helps the transformative process to help to unfold.
We have a few minutes left, and then we can take a quick Q&A session.
Wonderful. So a few things about touch, important relational need and transformative tool. I do think that we need to be very careful, and if you're not trained by touch, it's better to be on the safe side. In the studies, it's much easier. We have 2 people, we're 2 therapists, and we have lots of cameras, so it's a safety net. But I think when we look at touch, it's very important to look at the participant needs, participant history. If there is a sexual or physical abuse, be very careful where to touch, how to touch, when to touch. It's very important to look at the transference dynamic and the therapist competence, which I already mentioned. When we use touch, it's always after preparation, before the session, before the psychedelic session. There are lots of psychoeducation happening, an agreement around touch. Some people will tell you ahead of time, I don't want to go there, don't touch, no touch, leave it. And we will go there. We would trust their knowing. We always, as we offer touch, give the choice again to the participant. And we always naming that there is no sexual touch, and it's good to give options. Hands, touching the feet, putting hand on the shoulder. Yeah? So that's taste of something about touch. Okay, let's open it to questions. And I will stop sharing.
Thank you again so much for your wonderful presentation. And we have a few questions in the chat, so I will show the first one here. How would you help a client connect back to their body if they end up dissociating during the psychedelic trip?
So it very much depends on which medicine we use and what dose. But just a general guideline, I would say invite them to get connected to their breath and get connected to their weight. If it's an MDMA session, the weight is very much accessible. But also be careful, because if they're dissociated and left their body, there is a good reason. So when they go back to their body, they will meet something that it's a guest, but it's a experienced guest. Yeah. In terms of, you probably will meet a difficult part of the client that is the reason for the leaving the body. So invite them to come back slowly, but be very, very mindful of what they're going to meet and if they're ready for that.
Thank you so much for answering that. And we do have another question coming up. Can you speak to the role and limitations of applied somatic therapy in a psychedelic session?
So again, it's a great question, and it's a general one. So with MDMA, we're less limited in some ways. There is lots of options just to do the basic, which is invite the participant to be connected to their inner experience and to their body. Of course, the main limitation is what the client would like. Yes, sometimes they don't want to do any somatic work. It's very far away for them, or scary for them, and threatening. So we won't do that. Yeah, and it's also not, I would say, a mainstream way of working in psychotherapy. So many times we need a lot of psychoeducation and preparation, and invite the client slowly to get into this way of working, and there is a limited time. The studies are relatively, it's a short-term therapy, few months. If you go to more classical psychedelics, the inner experience is very, very rich and with lots of layers and dimension, mystical experiences. People are outside of their body in a very beautiful ways too. So you need to be more skillful around how to do body work, and if to do body work, and how to be in relationship to the somatic level of being. So there I would say you have to have more trainings in order to actually do somatic work.
Yes, thank you. And with that, we can wrap up here. If anyone has any final comments, questions, you can pose them now. And it looks like we do have one final one, and then we'll end it here. So Robert asks, with MDMA, there's discussion about loss of magic. My question, what might be different for people with CPTSD who don't really feel any magic, only mostly amphetamine type effects from the beginning?
I'm not very familiar with the loss of magic. I would say that with complex PTSD, those are people that the trauma is so connected to meaningful relationship. So the trigger is really, the trigger to very, very intense symptoms is being in relationship. And then the work is not only with the MDMA, but it's very much the MDMA and of course the preparation and the integration in the therapeutic relationship. There is a lot of that. And if I understand the question right, with the loss of magic, we don't have an agenda of having magic. We want that. I would say that my wish or my agenda will be for the people to be, for the participants to be connected to what is. So if the what is grief and pain and loss and fear, that's what we want them to be connected to. And that's a very meaningful piece of work to do. With complex PTSD, many times they need more time than few months, because the healing again happen in a very deep, the wounds happen in a very deep way in relationship, and the healing needs to happen in relationship, and it takes longer than few months, although we do see lots of improvement in a shorter term in the studies.
All right, thank you so much. I'm not sure if anyone on site has any final comments before we wrap up here.
No questions left. Okay, so Keren, thank you very much for this very interesting talk. Yeah, I think it's a hugely important topic. Yeah, thank you.
Thank you very much.
So enjoy the rest of the conference.
Yes, and many applause. We got over 200 people virtually here, so thank you so much, Keren. Have a lovely rest of the day.
Thank you, everybody, for joining. Thank you.
Thank you. Take care.